welcome to the channel. I'm Dr. Madhav Danthala. I'm a consultant medical oncologist and bone marrow transplant physician at Manipal hospitals in Vijayawada. In this video, we're going to be discussing about bone marrow transplants or stem cell transplants. A transplant is a procedure where we take a living tissue or organ and implant it in another part of the body or in another body. For instance, in a kidney transplant, we're replacing a diseased kidney, and in a liver transplant, we're replacing a diseased liver. Bone marrow is a soft, spongy, squishy, jelly-like substance inside your bones where your blood cells are formed. Red blood cells deliver oxygen around your body, required for your brain to function and your heart to beat. White blood cells are your body's immune system that normally defend us against infections. Platelets normally clot your blood to stop you from bleeding. All these specialized cells are formed from the hematopoietic or the blood-forming stem cells in the bone marrow. Your body uses stem cells to replace worn-out cells when they die. For example, each red blood cell survives for about 4 months. White blood cells and platelets live for only about a week or two and so must be constantly replaced. So, a bone marrow transplant or a stem cell transplant complex medical procedure that infuses healthy blood-forming stem cells to replace diseased or damaged bone marrow. These transplanted stem cells begin producing new healthy blood cells needed by the patient's body. Stem cells can be collected by direct aspiration from the bone marrow with the donor under general or spinal anesthesia. This was the only way we could physically retrieve stem cells in the past, hence the term bone marrow transplants. This is seldom done these days because we found ways to harvest stem cells directly from the peripheral blood. This can be done by injecting granulocyte colony stimulating factor or GCSF to stimulate the stem cells to leave the bone marrow and enter the peripheral blood. The donor then undergoes 1 or 2 or sometimes 3 leukopheresis procedures during which 10 to 20 liters of blood is processed using a blood cell separator like the Spectra Optia. The donor is hooked to this apheresis machine by an access line, and the component containing the stem cells is collected in a bag. What remains is returned through another line to complete the closed loop. This brings us to the end of the video. Thanks for watching. Don't forget to subscribe, hit the like button.